Okay, guys, I hope you guys can see. This is the critical thinking and nursing process. This will help you answer questions on your TEAS exam, on your test, on anything dealing with nursing, basically. And not all the TEAS questions. No, some of the TEAS questions will come from what you learned back in early high school, late middle school. Anywho, so we're gonna do ADPI. Of course, I'm pretty sure if you have started nursing school already, you have heard of ADPI. ADPIE. A stands for assess in nursing. Assess is what is going on with your patient. Are they short of breath? Do they have a fever? Are they dehydrated? You are going to do the subjective versus objective method. So, subjective is what the patient is telling you. Is the patient telling you, I've been throwing up, I can't breathe, my stomach is cramping, things like that. Objective is what do you see physically? Let's backtrack. Subjective is going to be the emotional feelings, basically what the teacher will tell you. I'm not a teacher, I'm just telling y'all what I know from when I was in nursing school. So basically subjective is going to be the personal emotion that the resident is feeling or patient is feeling. Objective is going to be what do you see. Okay, this is a big one. For example, charting purposes, if you have a patient that has a fall, if a patient has a fall, they're when you chart, they're gonna want to know what did you see when you walked in, what all happened. They don't want to know who said what or who said they felt like this and they was in here when they fell. No, they want to know. Okay, when you go in here, resident or patient lying on floor in front of the bed, in front of the bathroom, lying on the right side, no complaints of any pains or complaints of leg pain, hip pain, butt pain, whatever kind of pain, stuff like that. That is the objective. What did you see? Well, I ain't gonna say they complaining of this, but you can put that in your note. But objective, resident lying on side, in room, in front of bathroom, CNA and staff assisted, or CNA and nurse assistant, resident up or patient up in the bed, vitals taken at this time, stuff like that. Okay. D stands for diagnose. Nursing diagnosis only. Like I just said, girl, only do like shortness of breath, resident is shortness of breath. That's when you do your objective. You don't put resident has pneumonia if it's not diagnosed. Girl, you're gonna get in trouble. You don't you don't do a medical diagnosis. That's for the PAs, the MPs, and whoever the provider is. You do your regular nursing diagnosis for whatever you see